Hello, my name is Vibhuchita Jalu, and I'm current third-year internal medicine resident at the Cleveland Clinic in Cleveland, Ohio. The title of my presentation is the Exocrine Pancreatic Insufficiency Treatment in Chronic Pancreatitis remains suboptimal and is significantly lower in minority patients. Background: chronic pancreatitis is associated with complications including exocrine pancreatic insufficiency, with pancreatic enzyme replacement therapy being the mainstay of treatment for exocrine pancreatic insufficiency. The aim of our study was to investigate the prevalence of exocrine pancreatic insufficiency treatment with pancreatic enzyme replacement therapy in patients with chronic pancreatitis and to determine positive and negative predictors that influence initiation of PERT in patients with chronic pancreatitis. We utilized the database Explorers, where we then identified patients with chronic pancreatitis using SNOMED CT diagnosis, further identifying chronic pancreatitis patients prescribed PERT after chronic pancreatitis diagnosis. We then performed a case control study comparing patients with chronic pancreatitis with and without pancreatic enzyme replacement therapy. Logistic regression models were then constructed. The variables that we looked at included age, gender, ethnicity, race, smoking and alcohol and marijuana status. We also looked at the comorbidities of diabetes, coagulopathy, vitamin D deficiency, osteoporosis, malnutrition, bariatric surgery, celiac disease, myocardial infarction, and pancreatic cancer. The database we utilized contained 64,213,430 patients. From there, we identified 96,960 patients, or 0.15% with chronic pancreatitis. Of those identified patients, only 13,540 patients, 14%, were prescribed pancreatic enzyme replacement therapy. The grand conclusions we made in this database study: exocrine pancreatic insufficiency in chronic pancreatitis remains undertreated, with only 14% of patients being prescribed pancreatic enzyme replacement therapy. African American and Hispanic patients were disproportionately affected by a lack of pancreatic enzyme replacement therapy prescription compared to Caucasian patients with chronic pancreatitis. Patients with comorbid conditions associated with exocrine pancreatic insufficiency were more likely to be prescribed pancreatic enzyme replacement therapy. We noted that interventions to optimize the treatment of exocrine pancreatic insufficiency in chronic pancreatitis are needed to clinically treat exocrine pancreatic insufficiency and prevent further complications. Thank you for your time.